Is the coronavirus like chickenpox? Once you get it, do you build immunity to it? Today, I'm going to be answering some of your COVID-19 questions and other strange, I guess you could say, medical questions from social media. No question is off limits today. You asked and I'm answering. Hey everyone, I'm Dr. Jordan Wagner. I'm a board certified emergency medicine physician, and on my show, I answer your urgent medical questions and clear up myths about certain deadly diseases. If you haven't already done so, please make sure that you hit the subscribe button and turn your bell notifications on. That way you're notified instantly when I post a new video. All right, let's dive in. First question. I have some N95 masks with valves left over from my work as a painter. Could I cover the valves with duct tape and use them in public to protect myself and others from the coronavirus? Is this effective? Anyone know? Dr. ER, what would you suggest? The valves should be covered to help decrease what you exhale. In the hospital setting, we put surgical masks over the N95 mask, which has a valve. You can put a cloth mask over it as well. You can also put tape on it, but typically it's a little tough to make that work pretty well. Are people with kidney transplants surviving COVID-19, or is it automatically a death sentence? Speaking from my experience in the ER, I've not seen an abnormally high rate with patients who have undergone a kidney transplant or other transplants. Typically, patients with hypertension, diabetes, and obesity are hit hardest with COVID-19. Obviously, any population with chronic medical conditions needs to be careful right now. What is a great way to treat PTSD stemmed from physical abuse? By the way, I love your explanations on Experts React. PTSD is nothing to take lightly. I definitely think someone needs to address it from multiple angles, meaning discussions, activities, maybe medications, but all this needs to be under the guidance of a team compiled of medical doctors, counselors, and psychologists. So in Brazil, we have a myth about eating mangoes with milk, and the old people keep telling us it can cause stomach problems. Is it true? Although the older people in your community tend to be wiser, this is a myth. Rumored from a long time ago, sometimes milk in general can bother people's stomachs, but there's no current scientific evidence that supports that claim. Hey doc, can coronavirus enter into our bodies through the eyes? In that case, will wearing sunglasses prevent it? Good question. So, there isn't much research on this, but there is a concern. In communities with high numbers of COVID-19 cases, many hospitals are requiring all the staff to wear protective eyewear. So, I'd say go ahead, wear them if you want extra protection. That is just fine. Can you have a normal background? That hospital picture is really distracting. What hospital picture? I cleared out the ER before I film all of my videos. Pretty neat, huh? If someone has a high amount of glucose in their blood, does this make them more attractive to mosquitoes? Good question. The mosquito doesn't know what blood sugar is. This is more myth than fact, but they are attracted to certain blood types. Is the coronavirus like chickenpox? Once you get it, you build immunity to it. The coronavirus is different from the chickenpox, but in some ways it's similar. I know, confusing. When we get a virus, we develop antibodies against them. The determining factor ends up being how long do those antibodies stay in our body. Chickenpox stays around a long time, but other viruses don't, and that is what scientists are trying to figure out about COVID-19 currently. Don't know if this is fact, but I heard another doctor saying that they realized you can bake the mask, the N95 mask, at 160 degrees for 30 minutes, but I haven't tried it, and I'm not sure the elastic straps will actually hold up, or if the whole entire thing will go up in flames. Might be worth looking into, since it was a pretty reputable doc saying it. I have read about that as well. That was one of the ways to try to kill the viruses and the germs on the masks. Remember that the N95 mask is typically plastic and has electrically charged particles in it. So we don't know exactly what is happening if you bake it. It's probably best to use one of those UV lights that kill bacteria. All right, that's been a quick medical question session with me, Dr. Wagner. Let me know in the comments if you have any other medical questions that you'd like me to answer. Maybe I'll include them in the next video. Hit me up on Instagram, Facebook, or Twitter. I'll be sure to respond. And as always, make sure you subscribe and turn your bell notifications on. Thank you so much for watching, and stay healthy, my friends.